All right, welcome back. It's time for us to have a conversation on the health segment. And today, we're going to be talking hemophilia. What is hemophilia? How do you get it? And what can you do to live with the condition? Can it be cured? Well, we're going to find out today. Dr. Kelvin Owusu has joined us again on the show. Good morning, Doc.
Good morning, David.
Looking your usual dapper self.
Very
Thank you.
Great color.
Yeah.
As usual, my guy has sorted me out.
Oh, your guy did, Charlie. One in town. Yeah.
He's a solid guy,
He's
definitely.
very, very solid. Very solid.
Yeah, so hemophilia,
Yes.
what is it?
Well, by the name, if you break the name down, it's kind of like love for blood or love for bleeding.
Yes.
You know, so it has to do with bleeding. So, I mean, picture this. You took your son for circumcision, right? And then they successfully did the circumcision. There seemed to be no problem. But then you take this child home, and he's still bleeding.
Yeah.
You know, keeps bleeding.
Yeah.
One day is gone, he's still bleeding, you know, and literally bleeds to death. You know, that's actually something that actually happened. I mean, a story that actually happened. I actually witnessed one like that. They came to the hospital a bit late, so we couldn't do much for this baby, you know. And it's something that happens quite often, especially for those who give birth in unapproved circumstances, you know, because one of the conditions that actually prevents the blood from clotting. You see, when you get a wound, when there's a cut on your skin or anywhere, the processes are initiated to clot to prevent the blood from continuously pouring out. And that's the clotting, you know, process. And there are different things involved. There are the platelets, which are the first line. They go and plug the place. And then there are things called clotting factors, which are actually proteins. Yeah. Now these proteins actually form some kind of web to, you know, to seal the wound. A mesh kind of. You know, and some of these factors, two of them in particular, clotting factor 8 and factor 9, are the ones that are missing in persons who have this condition called hemophilia. It's actually an inherited condition, and so you actually inherit it from your parents. Usually, it's from the mother. Usually it's from the mother because it's an X-linked genetic condition, X-linked recessive. You know, which means that ideally you'd have needed 2 copies. You know, so you hardly actually find females who are hemophiliacs. I mean, you hardly they are around, but then you hardly come across them because you need 2 copies because it's a recessive gene. It means that both of your genes must carry it. So if you are female, which means you are XX, right, both X's must have the recessive gene for you to manifest the symptoms of hemophilia. Of course, there are people who are only carriers, which means they have only one X gene that's affected, and they also tend to demonstrate the symptoms. But it's again not too common, you know. So girls would usually be carriers because they would usually only get one X from either their father or their mother. But men only carry one X. You know, because men are XY. So if your father has hemophilia, it means he already has only one X, which carries the genes. So automatically, you pass it on to the daughters. The daughters become carriers. If your mother is a carrier of the gene, 50% probability that you as a boy would get it. You know, but if your mother has the condition, which means it's a double recessive XX, then definitely all the male children are going to have the disease.
Whoa.
Yes.
Okay.
So it is an X-linked recessive condition. So you find it in male. Once you get the X gene, you have it. So I mean, in terms of frequency, about 1 in 5,000 children, 1 in 5,000 boys actually do have the hemophiliac condition.
What about in Ghana specifically?
In Ghana specifically, I mean, as usual, I'm not proud to say we don't have much data, but we do see them. I mean, we see them enough times to actually investigate. So one of the things that are done at birth, there's another condition which is kind of similar, called hemorrhagic disease of the newborn. And this is because most newborns are born with very low vitamin K. Vitamin K also plays a major role in this clotting process, the clotting cascade that I described earlier. And so ideally, every child that is born gets a shot of vitamin K at birth to try and minimize this incidence. And so if a child is given this vitamin K shot and still demonstrates the bleeding tendencies, one of the things that we actually investigate is hemophiliac to find out if this child is hemophiliac or not. You know, so it is common enough for us to actually have it at the back of our mind every time we attend to anybody with a bleeding disorder.
I see. So is that the only way you identify?
Well, most of the time, the earliest way that you identify some of these things is when there's bleeding after circumcision, because, like I mentioned, it's mostly males who have the symptoms. So mostly it's bleeding after circumcision.
Okay.
But of course, there are other ways of diagnosing it. I mean, sometimes there can be bleeding spontaneously. You know, you could just be sitting down and you start noticing that you are bleeding from the gum, or maybe you are eating your favorite chicken wing, and then it clips your gum, and then you start bleeding and the bleeding is not stopping. You see, that might be the first time you come across it. Sometimes too, you may just have a small bump, you know, you are trying to get out of the room, and then you hit your knee against the arm of the chair, and then it starts swelling, and it swells, so the kind of swelling doesn't even match the injury, you know. And so that's also another way that this condition is picked up. So they tend to present with joint swelling as a result of bleeding into the joint, you know, and see, the joint is a very sterile area where we don't want anything else to go in there. So blood in the joint is not a good thing. So they present with a lot of pain. Sometimes it gets so tense because if you've seen a picture of a joint, you know, you see that the things surrounding the joint are hard.
Yes.
You know, you have muscle, tendons, ligaments, which are hard things. So if blood goes in there and the blood is trying to stretch out, it can be very, very painful. And eventually, over time, if this condition is not treated properly, recurrent bleeding into the joint can actually cause the joint, it can destroy the joint. You know, so yes, so you're going to have complications, arthritis, and its related complications. So yes, bleeding into the joint is another thing, you know. And I mean, as children, they play. Yes. And again, remember that it's boys. And boys, as they say, will be boys. So they are going to get bumps and cuts and bruises all over the place. And so anything that draws blood can become something else. I mean, they can bleed all the way to death. So yes, so it's a major thing that you need to be aware. And you see, I don't know if I should say thankfully or not, but it's because it runs in families. You know, people who have children who have the disease are aware that it's in the family. You know, it may escape my generation because my mother was only a carrier. You know, but there's some history to suggest that it runs in the family, so they tend to be aware. You know, but of course, education is also important, because even if you are aware that there's people in my family bleed a lot, you may not know what is causing that bleeding. You see, because you may not have been formally diagnosed. You know, and so it's something that you need to be aware that there's actually some treatment available that can actually help you to live some semblance of normal life.
We know that, like you said, it affects males mostly, but it does occur in some women as well.
Yes.
So where you have situations like, let's say, a woman who gives birth and bleeds uncontrollably, or
the monthly cycle.
You've even gone too far. The monthly cycle, they tend to bleed heavily. I mean, because the blood is not clotting,
right?
You know, so once the period begins, it's a race against time to try and stop it in time. You see, so I mean, it's not maybe that's why God made it such that it's not common in women, because I mean, it's you cannot stop your regular cycle because you are hemophiliac. You know, so there needs to be some way of making sure that your monthly cycle does not become a death sentence, right? You know, because every month, that means every month, yes. So it happens in women, and of course at delivery too, it becomes a challenge, because there's already, even people without hemophilia are at risk of dying from bleeding during pregnancy, because you see, pregnancy itself puts you at the how do I put it? The body positions itself to. The blood is thinner during pregnancy to try and supply the baby and all. So already there's a problem with clotting, you see, which is why maternal mortality due to postpartum hemorrhage is a reality. I mean, if a woman starts bleeding after labor, you don't have time to even pick phone and call somebody. So you as a medic or you as a midwife, your first response is to dive in and then start shouting. In fact, in the literature, it's there. You start shouting for help. There's no time to pick phone and call somebody. So you have to shout for somebody else to make the call. You have to dive in and start doing things to try and control the bleeding. So imagine this person, apart from having delivered, also has hemophilia. So it is indeed a major challenge, which is why it's important to know that this situation exists even before you know the labor process begins, so that you prepare adequately. Because like I said, there are measures in place, things that can be done to enable a successful delivery of baby. And when I say successful, I mean to have a healthy baby
and mother.
Exactly.
Okay. Treatment methods. What are the options for people who are hemophilia?
Well, it starts with diagnosis. So diagnosis is very, very important. So I must say that the fact that in your family, as they say, we tend to bleed a lot doesn't make it normal. So first of all, you must understand that there's something abnormal going on in your particular family. You know, it's not okay to have your a cut on your toe and to bleed for 1 day. You know, it's not okay. So if you are experiencing something like that, or if anybody in your family is experiencing something like that, you need to have the person report to hospital. Even though he or she may not seem sick, let them go to hospital so that the appropriate diagnosis can be made. And once the diagnosis is made and they say that the person is hemophiliac, I mean, there are two types where we don't need to go into details. There's A and B.
Okay.
You know, but once the diagnosis is made, then they will determine which factor is missing. Is it factor 8 or is it factor 9?
Okay.
So that if it's factor 8, then it means that this person would need regular or routine replacement of factor 8. If it's factor 9, then this person will need regular replacement of factor 9 because he or she is unable to produce enough of the factor 8 and factor 9 to enable clotting to happen. You know, sometimes in emergency situations, we can actually use something called fresh and frozen plasma. I mean, I'm an Ashanti, so this word, whenever this combination of words is not easy.
Fresh or frozen.
Yes, fresh frozen plasma. You know, which is actually why it's important that each of us donates blood. You know, I mean, there are a lot of people in this studio right now. If everybody donated a pint of blood, you know, that's good. You see, because when you donate blood, what you have actually done, and I'm sure you've heard this being said around, that every unit of blood donated saves about 3 or 4 different lives.
Okay.
See, because they can actually separate the blood into the red blood cells, the plasma, even the platelets can be taken out, you know, so that just that 1 unit of blood has all these components that can be given to 4 different people. You know, so the plasma is one of the components of the blood that has been donated, and it contains, so if we took plasma from any of us here, since none of us has the diagnosis of hemophilia, it means that we have adequate levels of factor 8 and 9 in that plasma. So once you separate the plasma, we can actually give it to somebody who has hemophilia. And then in the emergency situation, that's factor 8 and factor 9 that's already in your plasma can then hold the fort in that other person so that the bleeding can stop. You know, so sometimes in emergency situation, we actually transfuse people with plasma so that they can get the clotting process initiated. So everybody should donate blood. It's very, very, very important. I mean, it cannot be overemphasized.
We have a question here. This is coming from Linda in Achimota, and she's asking, can my child with hemophilia play sports?
That's a very, very, I mean, it's a very good question. Unfortunately, it's not a question I can answer straightforward. You see, because it depends on how adequate the factor 8 and factor 9, I mean, depending on which type of hemophilia the child has, you know, because once we do the plasma replacement, or once we do the factor 8 replacement or factor 9 replacement for that matter, we can actually check the levels, and we can actually do something we call bleeding time. There's a test that can be done to confirm that indeed the bleeding time is within normal, in which case the child can then participate in whatever sports that he or she is doing. You see, but again, this would need careful monitoring by the appropriate doctors who tend to be the hematologists, yes. So the hematologists are the medical practitioners who are responsible for this condition. Once the diagnosis is made at the general hospital, you'd usually be referred to either a pediatric hematologist if it's a child, or an adult hematologist. Because, and this is interesting, so most people are born with hemophilia, but some people can actually develop it in adulthood.
Okay.
Why?
That's
It's not common, but it happens, and it follows a similar line like other autoimmune diseases. Some way, somehow, the body identifies the factor 8 or factor 9 as foreign, and so antibodies are produced that kill the factor. Exactly. And so suddenly you've had a normal life all this while, then suddenly now you get a cut, or you're cutting your nail, you clip yourself, and then suddenly you've been bleeding for the whole day, and it doesn't make sense. Then we run the test, and suddenly you are hemophiliac. And how did it happen? So they can actually check for antibodies, and it turns out it could turn out that you have antibodies against factor 8 or factor 9. So it's important that once you notice unusual bleeding, or bleeding that is not stopping as it's supposed to, you know, you need to do something about it, because it's not normal. You know. Yes.
Mami in Dansuman is asking, how do I know if my child suffers from hemophilia or not? Okay,
so I mean, like I mentioned, it all comes down to how much bleeding is occurring for the smallest of things. I mean, let's still use the nail cutting experience. I mean, you are it's already difficult enough cutting children's nails. So let's say they are cutting the nail and the child moves and it clips the finger, and this child is bleeding from that small thing which should have actually closed in a matter of seconds, but it's still bleeding after 5 minutes, after 10 minutes, after 15 minutes. I mean, this is unacceptable, you know. And it's happened once, it's happened twice. You should know that there's something going on. You should report immediately. You see, so that's one way. And especially in children, babies, they have lighter skin. You can actually see through the skin, in quotes. So you wake up in the morning, you suddenly notice a bruise on the skin, on the hand, the forehead, somewhere. The child hasn't fallen down. Nobody has beaten the child. So why is there such a bruise? You know, you want to investigate and find out why, especially if it's at multiple places. Or you notice that suddenly one of the joints is swelling. You know, there could be something going on. So you want to find out, why is my child's joint swelling when he hasn't had any injury? You see, so these are some of the things that can draw your attention to the fact that something may be going on.
On Facebook, Prince Emma is asking, please, I always bleed when pasting. I mean, I'm sure it's brushing your teeth. What about that?
So if you are bleeding during brushing your teeth, I mean, it could be that you are using the wrong toothbrush. It's too hard. You know, we assume that smokers' toothbrush is the best. It's actually not. You know, so you might be injuring yourself as you are brushing. So that's one thing. Or you might have too much plaque, which has eaten into the gum, and so once there's already some inflammation. So once you touch it with your brush, it starts bleeding. So you really need to see a dentist to have it checked out. So that if they have ruled out all of this one and the bleeding is still occurring, then it could be that there's something going on, which might even be haemophilia, as we discussed earlier. Because gum bleeding is indeed one of the signs.
Wow.
Nose bleeding as well.
Oh,
yes.
Do we have enough hematologists in Ghana too, who are specialized in treating this, detecting it, all of that?
Do we have enough anything?
In Ghana? Charlie, especially medical professionals.
Yes, I mean, we are doing our best with what we have. I mean, most of the major hospitals have hematology clinics. So Kolebu, Konfanoche, Cape Coast, they all have hematology clinics that they run. So under the circumstances, we are doing the best that we can. But of course, more never hurts anything. So we need more of everything: hematologists, pediatricians, all of them, and so that we can enhance the quality of care. Even hematology nurses, you know. So we need a whole chain of specialties.
Are there any foods that people who are hemophiliacs should avoid?
In terms of hemophilia, there's really no connection with food. So I mean, it's not related to food in any way. So you can actually have your, I mean, enjoy your banku and anything you want.
Or any medication.
What about foods that thin the blood? You do, because right now you don't want to thin your blood any further. So
you know, it's. I'm hesitating to say so, because when we say, I mean, I know I mentioned thinning the blood early on, but it's there are so many different factors, you see, because most of the foods that do those things, they operate on the platelet level. So they really don't have any effect on the factor level. Remember it's a cascade and involves different components at different times. So when you hurt yourself, initially the platelets that will move in first to try and close. Then the factors will now come in to try and form a mesh under the platelets to seal the wound. You know, so most of the thinners, even some of the blood thinners that we take as medication, they work on the platelet level. You know, so yes, in terms of food, there's really no direct connection between hemophilia and food, so you can enjoy your food for now.
So Henry's asking, my mom bleeds from her nose from time to time. What's that about?
So, I mean, as I mentioned, nose bleeding could be one of the early signs of hemophilia, but it's not the only cause of nose bleeding. There are other things that can cause nose bleeding as well. Interestingly, hypertension can actually cause nose bleeding. So if somebody has recurring nose bleeding, one of the things you might notice that the blood pressure is actually high, because inside the nose there's an area where it's called Little's area or something. The vessels are very, very delicate. They are very fragile, which is why even during Harmattan you can actually just start bleeding from the nose. Or if you are fond of picking your nose, you might just touch something and it starts bleeding because it's very, very fragile. You know, so there are so many things that can cause nose bleeding. atmospheric conditions can even cause nose bleeding. So what I would say is that if this is happening often and is concerning, they need to see an ENT specialist. I mean, there's a doctor purposely for the nose. So this problem has been solved many years ago.
That's good to know. Okay.
Wow, thank you. Thank you very much. This is very insightful,
yeah.
very useful. Thank you. So people want to ask you any further questions, how can they reach out to you?
Well, you can find me on social media, Kelvin Owusu MD, or you can follow my clinic page as well, Claron Health International, and then drop your question, and we'll definitely attend to you as soon as possible.
Okay.
Awesome.
Claron Health International, it's on which platform?
On all platforms.
All the different
including
platforms.
LinkedIn.
Oh, okay.
Yeah.
Okay, that's good. Final question here. Abna is asking, what about bleeding in your stool frequently?
Well, I mean, so
is
that
it just constipation or
so constipation can cause bleeding in your stool, hemorrhoids can cause bleeding in your stool, and hemophilia can also cause bleeding in your stool. And so we need to rule out all the common we need to do further investigation and rule out the common causes before we go and think about hemophilia. So it could just be that you're not eating enough fruits and vegetables. So get on the mangoes and and the oranges.
It could be
Can we also say, people, don't send this message. Go and see your doctor. If you've got blood in your stool, nose bleeds.
No, but
which one else? There are some other ones.
But it's good that you're asking.
Charlie.
Pasting.
Go and see your, please. Go to the doctor. Get evaluated in person.
Very, very important.
Because doc can only speculate. He can. Charlie. The wait when the thing gets really serious. Meanwhile, it started with you saw a bit of blood in your stool. Charlie, go and get, please.
I mean, so let me blow your mind. Even cancer can
start with
blood in your stool. So now, I hope I've shocked you enough to go
to Claron, like actually get to Claron Health and go and see doc in person, please.
It's true.
Okay.
Yeah. In Kaswa says, I love the discussion. Well, thank you for letting us know and keep watching CDTV. Well, we're going to take a short break. Thank you very much to Dr. Kelvin.
Thank you.
And we will be right back after this.